The federal government warning Tennessee lawmakers that getting rid of state legislation that allows Ballad to operate as a monopoly could do more harm for patients in the region.
It all surrounds the Certificate of Public Advantage, also known as a COPA. That legislation allows the monopoly, but also regulates it. The Federal Trade Commission says repealing COPA would remove those regulations without fostering any kind of competition.
That's unless Tennessee lawmakers also remove certain barriers for healthcare providers to set up in the area. One such barrier to opening new hospitals could end in Northeast Tennessee by mid-2028. Local lawmakers say that action could spur competition.
In addition to ending the COPA, they also support an amendment to end what's called the Certificate of Need requirements 2 years early in Northeast Tennessee. News Channel 11's Jeff Keeling has tracked both of these bills. So Jeff, what are the implications of this legislation?
Well, legislators say aligning those two dates can help pave the way to a competitive hospital market for the first time since 2017. A health policy analyst who's studied state-sanctioned hospital monopolies, including Ballad, is less optimistic.
State Senator Bobby Harshbarger is bullish on the prospects of a non-Ballad hospital in Northeast Tennessee if the regulatory hurdle of Certificate of Need is gone.
I believe there are facilities or there are companies that will want to invest in upper Northeast Tennessee to build that competition.
Brown University professor Erin Fusay-Brown is skeptical. She says opening new hospitals is tough enough.
Setting aside Certificate of Need, it's just extremely expensive. You need to contract with all the health insurance companies. You need to get accredited. You need to participate in Medicare and Medicaid. You need to hire staff.
Making ground-up construction a rare choice.
When health systems are growing, they do not open new hospitals. They buy existing hospitals.
Harshbarger and his House colleague Tim Hicks admit the process won't be simple, partly for the demographic and income reasons that justified Ballad's formation in the first place.
Northeast Tennessee is a challenge for most healthcare corporations to move into simply because of the folks that we have and the health needs that we have.
It's not cheap to build a hospital. I mean, I don't want to speculate, but I can only imagine it's a few $100 million. And they've got to be able to make sure that the payer mix will be sustainable.
Fusay-Brown has studied state-approved hospital monopolies, including Ballad's, and said market power ups the degree of difficulty.
The barriers to entry are astronomically worse when you have a dominant presence. Then it's very hard to come in as a new entrant and not be basically driven out of the market.
Hicks acknowledges that Ballad,
for some time to come, will be the mainstay for our health needs in Northeast Tennessee, but we look forward to other avenues if that happens.
He says he's heard fewer constituent complaints about Ballad the past few years, but adds,
I believe in free market. I think competition will make Ballad better.
Fusay-Brown warns against lifting any regulations on Ballad until that time comes.
The idea that again, just trust us with our monopoly. This is just, again, not been borne out. Monopoly healthcare providers, even if they're nonprofit, tend to act as monopolists. They tend to disinvest in things that make them less money, and that isn't good for the population or the community, but is good for their bottom line. And that, without these conditions, there's no way to hold their feet to the fire.
The COPA bill has not gone before the full House. If it does pass, Ballad will remain under the current regulations for an additional 2 years. Ballad, meanwhile, has told us in a statement they remain committed to improved healthcare access for everyone in the region and that the system will continue complying with state and federal antitrust law.
Jeff, thank you very much. Ballad Health sent us a statement saying in part, quote, regardless of the COPA, the oversight of antitrust in Tennessee lies with the Attorney General, who acts independently. Ballad Health will continue to comply with state and federal antitrust law and would expect swift and serious action by the Attorney General if it were to violate such law.